Good morning, everyone. I was really pleased to be invited to speak at your AGM as it gives me an opportunity to thank everyone involved with Lanarkshire Carers after a particularly challenging 18 months. I'd like to say a huge thanks to all the carers attending for the endless support you provide to your families and friends. I understand that many of you have been under even greater pressure than usual, and I appreciate all the extra support you have been providing to all those you care for. I also realise the last few months have been extremely busy and demanding for carer support staff. I have been so impressed with the way you and carer centres across Scotland have adapted your services and helped the large number of additional carers coming forward for support. Thank you all for your hard work and commitment to providing such a vital lifeline to carers in your area. We highlighted this rising demand when informing local authorities about the extra £28.5 million for the Carers Act in this year's budget. Added to similar baseline increases in previous years since the Act took effect in 2018, this brings the total additional investment to £68 million per year. Because of all of the additional pressures we're seeing, it is more important than ever that these funds are used to expand carer support. Breaks from caring are always going to be a key aspect of that support, so I welcome this morning's focus on short breaks and on sharing good practice, resources and ideas. I remain committed to the Scottish Government's £3 million voluntary sector short breaks fund and would like to thank Lanarkshire Carers for continuing to deliver Time to Live grants locally. I was pleased that we were able to put an additional £1.1 million into the overall fund last year, and we have committed a further £570,000 this year, including an extra £400,000 for Time to Live. And I know that Lanarkshire Carers has a strong track record in helping carers identify what is important to them and what best support meets their needs. I realise that there are challenges in the availability of breaks, which is why we funded the Promoting Variety in Short Breaks project developed by Shared Care Scotland and Health Improvement Scotland to help local authority commissioners use their influence to encourage more short break options. I also appreciate that access to day centres and residential respite services has been limited. And we continue to engage with local authorities and health and social care partnerships to support the reopening of these vital services in line with wider physical distancing requirements. The recent independent review of adult social care also highlighted the need for better access to breaks and recommended establishing a new right to breaks from caring. We're currently consulting on how best to do this, as well as a number of other changes in our National Care Service consultation. If you have not already done so, I would really encourage you to get involved and have your say about how we can make the right improvements. It's vital that we get social care delivery right so we can help all people live the kind of lives that they want to live. Before I finish, I want to return to the important role of local carer organisations. I realise your focus today on short breaks is just one aspect of the vital support local carer centres offer. Thank you all, carers, staff and volunteers, for your efforts this year. I know you make a huge difference to your communities, helping ensure carers and cared for people continue to be supported and connected. Once again, thank you very much for all of your efforts, and I hope that you enjoy the rest of the event.